So today I'm going to teach about respiratory assessment. What is the respiratory assessment? So it is a ability to perform to the comprehensive respiratory assessment, appropriate documentation on pulse oximetry, rate, rhythm, and effect, inspect and observe, listen. So define, identify the signs and symptoms, common respiratory disease, and differentiate for normal or abnormal lungs. Understand the treatment of device used in respiratory care. So this is the respiratory. So up to nasal to still diaphragm, it will be called to respiratory system. So respiratory system, what are the function? It's a nostrils. The vapor hair enter, pharynx channel the hair down, then pharynx means hair, larynx means food. Okay, and pleural membrane helps to keep the lungs flexible. Then bronchus to allow the air enter to the right lungs. Ribs protect the respiratory organ. Intercostal muscle move the ribs during the breath. Diaphragm help to pump the lungs. Okay. Then nasal cavity, it's purify, remodify the air. Oral cavity lets air and food enter. Epiglottis is it's keep food from entering the airways. Larynx means letting the air pass through the speech production. Trachea channel the air toward then left primary bronchus, it allow the enter the left lungs. Broncholysis, it lets air reach to the alveoli, and alveoli means O2 and CO2 to exchange. So what is the respiratory assessment? So respiratory assessment is the external assessment of ventilation. It's include the observation of rate, depth, and pattern of respiration. So what are the accurate means? It recognizes to the normal thoracic and abdominal movements. So what is the normal assessment means? Abnormal thoracic movement. So on inspiration, diaphragm is contract, then causing for abdominal organ to move the downward or forward. It increase the vertical space of the chest cavity. At the same time, the ribs lift upward and outward. It's a sternum. It's called transverse expression of the lungs. So what is the expression means? That diaphragm reflects upward, that sternum return to the relaxed position. It's called for original positions. Then assess the signs and symptoms. So complaint is dyspnea, then bluish cyanotic appearance of nails and nail beds, lips, mucous membrane, and skin. Then restlessness, irritability, confusions, and decreased level of consciousness. So pain during inspiration and expression, labor or difficult breathing, orthopnea, use the accessory of muscles. So abnormal breath sounds such as a wheeze, then inability to breathe for spontaneously, and thick for the blood taint or sputum production. So paradoxical chest wall movement will be there. So what is the factor means? Activity, anxiety, acute pain, and gastric distension, medication, body position, presence of abdominal incision or dressings, then fever. So it is at the influence. Then pulse oximeter, how we can check? We can use for index finger. So we can see the rate of check the pulse and O2 level. So how to will assess the rate and rhythm means keep the patient for comfortable position to upright position. Otherwise, sitting position for 90 degree. Provide emotional support to reduce the anxiety associated with the dyspnea. Observe the patient chest movement, shape or symmetry. Then adult for means thorax wide transverse diameter to anterior and posterior. Then older adult means it developed to the barial chest for COD patients. To observe the patient, shortness of breath or without exertion of the orthopnea. Orthopnea means absence of breath. Okay. Then it's forward to learning position to adequate breath. Then orthopnea means the patient chronic obstructive of pulmonary disease, they can suffer for orthopnea. So they're sitting like this means that shoulder it will come like means lean forward means that they will be relaxed. If sitting on the edge of the bed and arms to fold and placed to two of the three pillows, each position for high height. So normal breath sound. Normal breath means tracheal, bronchial. So one more is there. Tracheal sound means if the trachea, so that sound will be blown through the pipe like this. So bronchial means it's a large airway. It's entered to the chest. Third, intercostal base. So it will be sound for vascular sound. Okay. Then bronchovascular. So bronchovascular means is posterior. So here branchial means anterior. Bronchovascular means that is for the posterior. Okay, so it between the scapula, it's center of the anterior chest. So this is for the brachial sound. So vesicular sound, vesicular is the soft and blowing and rustling sound. Throughout the most junk filled it will be there. Okay, then abnormal breath sound means crackles. Crackles means it's a flu. It's caused by the fluid and a small airways or atelectasia will be there. So crackles are referred by the discontinuous sounds. So intermediate, non-musical or brief like this will be there. So that is the crackle sound. We can crackle, we are telling that one. Then wheezing sound. So wheezing sound everyone knows. While inspiration or expression, that sound will be hard. Okay. Then fluid frustration lapse. It's a low pitched and cracking sound occur to inflammation of the fluid surfaces. Then steroid. Steroid means it's a high pitched sound. Okay. Plural means low pitched sound. Steroid means high pitched sound. So it will be mainly happen to the obstruction of the upper airway. Then patterns of the respiration. So what are the patients will be there means apnea. Apnea means it's a respiratory causes for severe second. It's result for respiratory arrest. Then plot respiration. So this is for irregular respiration, various depth and interpret of the periods of apnea. Then bradypnea. Bradypnea is means normal breath rate 12 to 18. So below 12 means it's a bradypnea. Then sinus stroke respiration. So it will be irregular. It alternating period apnea or hyperventilation where patient have ventilation, hyperventilation will be there. So respiratory cycle begins to the slow and shallow breath will be there. Then hyperpnea. Hyperpnea means it's a increased depth. It's normally during the exercise. Then hyperventilation. So rate and depth of the respiration increase. Then it will be leads to hypocarbia. It's a abnormal low level of carbon dioxide. So that is the uh, carbon dioxide in the blood. So that is for the hyperventilation. Hypo means it is respiratory rates for abnormal low and ventilation may be depressed and the hypocarbia abnormally elevated, that is hypoventilation. So Kussmaul respiration. Kussmaul respiration means it's commonly diabetic ketoacidosis patient they have Kussmaul respiration. Then tachypnea means more than 20 we will call for tachypnea. Then common respiratory illness means asthma. So everyone knows commonly respiratory problem means asthma is. So it's a chronic inflammatory disease that affect the airway and characterized by the reversible airway obstruction. So the hair inflammation or increase the hair response to stimulate. So during the exacerbation, there is a yearly phase of bronchoconstriction. The late passes is airway inflammation. So bronchoconstriction and bronchospasm is inflammatory means it will be treated. So here expressing of asthma, expression of rescue to relieve the medication. So administration of medication, they relieve the symptom to the patient. Then diagnostic, what are the diagnosis? Spiromotor. So we can give spirometer, then message how much their bowel is there increasing and how much fast they're flowing. We can diagnose. Then methacholine and monitor changes. So during the test to increasing the amount of ether methacholine aerosol, it's monitor the dry mannitol dry powder to inhaler. So the lungs function they will check. Okay, the test is positive, the lung function is dropping to the challenge. So patient and family education. Assure the patient to family asthma symptom can be controlled with managed properly and proper self management is important. We can educate. So what are the document we can see the patient means frequent daytime symptoms and frequent nighttime symptoms and short acting beta against beta agonist use and current asthma severity and update of the asthma action plan. Then unexpected outcomes related to intervention, patient and family education, peak flow rate result. So next, pneumonia. Pneumonia is the inflammation of the pulmonary parenchyma or alveoli. Then both caused viruses agent for some foreign bodies. It's caused for pneumonia. Pneumonia mainly, what are the symptoms means acute and insidious onset, mild fever, severe cough and malaise, and high fever, severe cough or diaphoresis will be there. So non-productive or productive coughs will be there. Then wheezing and frying crackles will be there. So diagnosis means chest X-ray. So it's to look for inflammation in your lungs. So chest X-ray is the best test for the pneumonia. So blood test is CBC test they can check. Then immunity test they can check. So blood culture means that bacteria growth they will check. Then prevention. What are the prevention means? Mainly to prevent the pneumonia. So pneumococcal vaccination we can take. So 23 different strain of bacteria will be there. So to identify the bacteria, to prevent the shorter amount of time to older adults, then should be administration every 5 years. Then positive infection control program, we can educate dental or oral hygienic of aspiration of pneumonia, depending feeds and depend for oral hygienic and missing teething and tube feeding and multiple medication we can do. So nurses means nurses documentation, respiratory rate and depth and breathing pattern. Try supplemental oxygen therapy, then spiro readings, pre and post breathing treatment, then IV or oral medication, unexpected outcome from intervention. So family education, pain management or pain assessment and management. Then COPD. COPD is a chronic bronchitis. It's chronic bronchitis or emphysema they will call. So that lungs hard to breathe, that notes dyspnea will be happen. So damage the have a resistant lungs leads to short breath. It's impacting their ability to work, to exercise or sleep and perform to everyday activities. So main here spirometer use, then bronchodilator reversible test. Why they're using means standard spirometer test baseline measurement, but after about 15 minutes there will bronchodilator medication. How repeat it will be test like this. That is one for bronchodilator reversible test and positioning. So how the patient can be seated. It's a first image and they're sending. So that like this only we can check. So orthopnea position means it like this. Okay. Then COPD care. So what are the COPD care? Administers the oxygen or medication to indicated and prescription. Then oropharyngeal suction and emergency airway equipment to ready to available. Monitor the respiratory status if the patient condition deteriorates, more aggressive, assess and treat, reassess the pain, and closely monitor the hold patient to orthopnea patients require additional support and repositioning they will require. So COPD patient what will can observe and reported care provided, positions patient, then unexpected outcome, family education. Okay. So respiratory alcoholism and acidosis mainly we can see about for whenever working in ICU, because patient will take patient having ventilation, we can check the alcoholism and acidosis level. So we can take the ABG sample, we can check this all those. Okay. So respiratory alcoholism means it's a carbon dioxide and oxygen. So in the blood, so it's not balanced means it will be come for alcoholism. So respiratory alcoholism means when your breath is too fast or too deep, that carbon dioxide level too low. So that is maybe that pH level may be rise. So that is the alcoholin. So hyperventilation. So if a patient underlying the causes of respiratory alcoholism, the patient have over breath. So that time its alcoholism will be happen. So according to the acidosis alcoholism, patient PCO2 level they will change to the ventilator. So what are the causes of hyperventilation? Heart attack, pain, drug use, asthma, fever, and COPD, and infection, pulmonary embolism, and pregnancy. So what is the symptoms of alcoholism? Dizziness will be there, floating will be there, feeling lightheaded, numbness, muscle spasm, discomfort of the chest area, confusion, dry mouth, tinkling of the arms and heart palpitation and feeling short of breath. Okay, what is the causes mean? Asthma, COPD, pneumonia and sleep apnea. So what is the treatment of alcoholism? Means fill the paper bag with the carbon dioxide and exhaling it. So breathe the exhale air from the bag into the lungs. Repeat the several times. So if you are repeating severe some more times, it will be patient lung will be developed. Then respiratory assistosis. So what is the respiratory assist means? It is a can remove enough carbon dioxide to produce to the body. So already we are exhalate to the carbon dioxide that they can produce. So that time we can't breathe means that carbon dioxide will not go. So excess of the carbon dioxide gas causes the pH of the blood or other fluid. It increase means it's making them to acidic. So it's a body able to balance to iron to the control acidity. So the pH scale is for 0 to 14 will be there. So pH blood flow is 7.35 to 7.45, which normal pH level. So respiratory acidosis, what will be happen? So it typically caused by underlying disease or condition. It's called respiratory failure or ventilator failure. It will be happen. So forms of respiratory assessment: acute respiratory assistance and chronic respiratory acidosis. So acute means it's a medical emergency and symptoms will progressive worse. It's life threatening. Chronic means it developed over time. Does not cause for symptoms. It's adapt to the increased acidity and kidney and bicar will be maintained for the balance. What is the symptoms of respiratory acidosis means? Initially headache, anxiety and blur vision, restlessness, confusion will be there. So without treatment means there is sleep fatigue and lethargy, delirium, shortness of breath, coma they can go. So what are the treatment of acidosis means? Acute form means it's a treating of acute acidosis, usually addressing the main causes. Okay, then we can start the treatment of artificial ventilation. So chronic form means antibiotic, diuretics, then bronchodilators and corticosteroid they can given. So mainly they can use for intensive spirometer. So if you are using spirometer, we can use and hold the device and place the mouthpiece to the spiro and make the breathe for exhale and inhale they can do slowly. Okay, then peak flow meter. Peak flow meter means it's a portable handhold device. So for they can use for asthma patients. Then they're measuring of the peak flow for meter to important managing to the asthma symptom, preventing the asthma attack. Then how to use the peak flow meter? So stand up and sit up straight. Make sure indicated the bottom of the meter. So take the deep breath and filling the lungs completely. The mouthpiece into the mouth, slightly bite your teeth and close to your lips, then have from the mouthpiece. So best hair out has hard to as fast possible single low. Remove the meter from the mouth. Record the number of the meter they're taken like this. Okay, this is for the peak flow meter. So remaining device and all I can teach you next classes. Okay, thank you guys.